year World Diabetes Day theme is diabetes in workplace. Diabetes in workplace. Okay, you see, I was so busy because that's why I was unable to make a PowerPoint presentation. Just I give some title to Dr. Eshan and he recommended this. Okay, the theme of this year is diabetes in workplace. I mean, because diabetes is a such types of disease which is highly prevalent and it has lots of complications. The peoples in globally, if we see at present, a working age 20 to 79 years, near about 11.1% people are suffering from diabetes. 11% or 11 from 100 suffering from diabetes. In another word, we can say 1 from 10, 1 from 9, 9 from 1 people are suffering from diabetes. In our country, it is the global scenario. In our country, according to the IDF data, International Diabetic Federation 2025 and Diabetes Atlas 11. Based on the data, in Bangladesh presently 13% people are suffering from diabetes. It is known. Most of them are unknown also. So globally, 4 people from 10 is unknown about diabetes. They are suffering from diabetes, but they are not knowing about their condition. So this is the scenario. And scientists are thinking that if this scenario is going on, then in 2050, this scenario will be global people's 13% people will be suffering from this diabetes. And the position of diabetes in the world in Bangladesh is the 8th position now. China is the first position. Bangladesh is in the 8th position now. And we are, it is thinking that in 2050, the Bangladesh will be number in 7 if the condition is going on. So you are seeing this, how serious the condition of diabetes is. So today we are discussing here, how can we prevent and how can we manage this? That's why we are arranging this seminar. So please, next slide. Okay. Already I mentioned in Bangladesh session, I see already I mentioned Bangladesh. Just I am now mentioned on the diabetes theme. In 2025, diabetes their theme is the well-being in workplace. I mean, the people who are our colleague who is suffering from diabetes, we should be more cordial to them. We should not neglect them. We should not neglect. We should not do any kinds of negative attitude to them. An example I can give: the people who are suffering from diabetes, they are taking more water, they are going to washroom more times. So we should not laugh. We should not add negative comments to them. Rather than we should be more cordial to them. It's normal. It will be curable. It will be manageable. So we should give such types of support to him. This is the theme of this year. So that's why the person who is suffering from diabetes, he will not be mentally stressed, because previous speaker says that stress how is correlated with diabetes. The people who are suffering from stress, obviously they are suffering from diabetes. So we should make the work environment friendly environment. We should make the work environment cordial environment. We should make the work environment as a family environment. It should make it professional environment, not a hostile environment, not in a negative environment, not a stress related environment. That's the theme of the year of 2025. So from today, we should take decision that the colleague of ours who are working with us, working in an organization, the employer and the employee both should be more cordial, more positive to the patient who are suffering from diabetes. We should be more supportive to them. Okay, next. So why we call this integrating approach? It is integrating approach because any monotherapy or single therapy is quite impossible to manage diabetes. Lots of uh, lots of information, lots of related activities should be encouraged in the management of diabetes, because we know diabetes we have to maintain 3D: discipline, diet, and drug. First is discipline, number two is diet, number three is drug. But in our people who are suffering from diabetes, there means misconcept. They said that I took drug, so maybe I need not to take discipline or diet. No, it's wrong. The people who are suffering from diabetes, they should first maintain their discipline. Then they should maintain their drug. Already Natasha mentioned, and also mentioned that which drug we should take, we should avoid. And then finally drug. Drug is many types of drug, especially our allopathic drug, that is called our modern drug, Irani drug, Ayurvedic drug, also some single drug, some compound formulation. Lots of drugs are available. So you should consult with a doctor which you are reliable. It may be Irani doctor, it may be Ayurvedic doctor, it may be allopathic doctor, it may be homeopathic doctor, or any consultant you can consult who are expert on this related activity, the knowledge. You should contract with him and take medicine based on the guideline of the doctors. As well as drug is the number three. I am emphasizing on discipline. Discipline means your lifestyle, your food, what you should take, what you should be avoid. That is mostly important. So in case of dietary regimen, Ayurveda give us some guideline, like whole grains, like various types of grains. Grains means seeds types, like methi, like penegrik means our isabgul, methi, neem, um, karla. Already mentioned some earlier. So these types of we can take as a diet, and some fruits also: amla, jamun, guava, apple, which are rich in lots of polyphenols. So we should take it, and healthy fats, mustard oil, sesame oil, and some moderate ghee also you can take. And also we should avoid refined sugar, sugary drinks, beverages, foods, ultra processed food, and lots of foods such as fast food, junk foods, and the food which we see in the roadside. I mean street food and fast food. Obviously, we should avoid them, because food is medicine. You know, food is medicine. When we take something as a food, we should think the food value, not the taste. We should consider the food value, which types of vitamins, proteins, minerals are containing of this food. Not it is tasty, how much tasty, it is not the important. Important should be its health benefits. So one thing is the food what is tasty in mouth, that is harmful for our health. But the food what is not tasty in our mouth, but it is good for our health, like corolla, like neem, that is not tasty but that is helpful. But like sugar, like rasgulla, these are the tasty but unhealthy for the health. So Ayurveda give a special guideline on food, which should we take, who should not take. That is called ahar. And another is bihar. Bihar means lifestyle, what you should do, what you should not do. Okay, next. Okay. So some medicinal plants also we can take, like turmeric, turmeric, Panigruc, and already I said mentioned it. Gymnema sylvestre means Gymnema sylvestre means in our country we know it is as gurmar, aloe vera, amla, neem. I would like to mention one thing here. In my MPhil, I did a research on diabetes mellitus, and I interviewed 280 qualified registered physicians, and I knows from them what types of plants they are practicing in their daily life. And I found that total 77 plants they are using. 77 plants they are using in their daily practice. Among them, the most of the practitioners are using these types of plants like methi, like gurmar. They are using like Gymnema silvestri, like their amla. They are also using neem. They are also using mango seeds. Yeah, such types of I got more than uh, 30 is mostly commons and some are uncommon, but I got 77 plants they are practicing in their daily practice, and they assured that by using this single plant and using compound drug as well as dietary management and by doing exercise yoga, I mean integrative approaches, they are getting result. Only single drug is not enough for getting result. Only compound drug is not enough. Only exercise is not enough. If you would like to get result from diabetes management, obviously you should have to give combination approach, single drug, compound drug, lifestyle modification, food habit, ahar, bihar, do's and don't, which should be take, which should not take. Only we should take not only is enough. What should take, what should not take. It should be specified to the patient. And by this way, if we can do this, and some polyherbal formulation also like Nishamaloki, Tripola, Chandraprabha Boti in our Ayurveda, and also Bashantukshangar Rosh, I found that the doctors are using in their practice. These plants and these drugs have antioxidant properties, anti-inflammatory properties. They also regenerate also our beta cells and also improve insulin sensitivity and helps to increase the insulin secretion. And by these pharmacological activities, the plants and drugs are reducing our blood sugar and manage the diabetes management. Besides this drug, I would like to mention some exercise and yoga guidelines also. It is said that per week we should minimum walk 150 minutes. Per week we should walk minimum 150 minutes. But in the latest guideline of diabetes IDF in last April 2025, I joined in the Thailand in the International Conference on Diabetes mellitus, IDF conference. That conference, the presenters and the conference authority declared that it is not enough for walking 150 minutes per week. The guideline there, the latest guideline, when you will take food, you will walk 15 minutes minimum, 3 times in a day, in morning, in lunch, in night. When you will take some food, you will walk 15 minutes. That's why it will be the properly digest and it will be properly used in your body. That's why the glucose will not raise. So the latest guideline is to while you will take some food, you will take 10 to 15 minutes in your home, in your front of the office. You can in your office room you can walk 10 to 15 minutes. Number one. Number two, uh, we should do uh, uh, running, jogging, and these types of exercise minimum 3 to 4 days in a week, 2 to 3 days or 5 days in a week. We should do it. Besides this, we should do some functional exercise, chair squats, push-up, sit-ups, etc. And some yoga asana we should also do, Bhujangasana, Dhanurasana, Ardhamatsasana, Paschimottanasana. These types of asana we should also practice regularly. These are very easy practice. These are very easy force of yoga. We can do it. And also we can do some pranayama, especially Nadi Shodhana pranayama, Brahmari pranayama, Prastika pranayama. These are also very easy, and we should, if we practice this, our blood sugar will be in our control. So I mentioned here, first of all, the single drugs, some compound drugs, some dietary guideline, what should take, what should not take, what should be avoided. And besides this, I also mentioned some yoga exercise name, some pranayama, some meditation, and this is also some ahar bihar. I also mentioned here, especially we should avoid the sugar and sugar-based food, and obviously we should also avoid the ultra-processed food and like chips, chanachur, like biryani, like beef, more beef, as well as lots of street food, we should avoid, obviously. What we will take? We will take the food which are mostly tiktorosh in our academic Ayurveda, like neem, like gurmar, like talakucha, like these also we should take. Another thing is that methi. I would like to take is 1 minute for methi. You will every day you should take methi. In case of male, in case of female, both. Because in night you will 1 teaspoon of methi in a glass whole night, and morning you will just take the methi. And finally, when you will take this methi, it will improve your. In case of male, it will also give you stamina also. In case of female, it is helpful for the PCOS and other gynecological disorders. And when you will take this methi water, then keep this methi in, just boil this methi and paste it and use this in your hair. It will black your hair, strong your hair, and it will prevent hair fall also. So this is the methi, so much effective. So finally, in workplace, obviously we should also do some activities, and we should take healthy snacks. When at 10 or 11 in the morning, when we are in office, we should take some snacks. So what we do? We take some shingara, we take some samosa, or some which is the fast food or junk food. No, we should not do it. We should take some nuts. We should take some fruits. What is available in our country, like banana, like apple, like amloki. These types of fruits we can take available, which is available, so we can take it. And every day in workplace, we should, after 1 hour work, when we'll morning 10 to 11, 11 to 12, every 1 hour, after 1 hour, 5 minutes we should take rest. We should take our breathing space for our healthier lifestyle. It is also important. So finally, I would like to conclude my session is by this way, that the single therapy or monotherapy is quite impossible to mitigate diabetes. It prevention or management. So for managing diabetes, or if you would like to prevention or management, in both cases, we should take the combination therapy. It may be in single drug, maybe in compound drug. It is included with your yoga, included with your exercise, included with your ahar bihar, which you should take, you should not take. And finally, meditation, and also your willingness. Your willingness should be most important in here. So let us, we should take decision. In workplace, we will not negative attitude to our colleagues who have the diabetes, suffering from diabetes. And as well as we should also give the positive mentality for the attitude with the colleagues, as well as in our family members, in our society. We should guide the peoples. The diabetes is the most prevalent disease. We should we should take care of ourselves. Health is wealth. We should take care. We should be more aware, and we should to know why it is occurring and what can we prevent, because it is a preventable disease. So let us, we should start our day from tomorrow by the mission of prevention of diabetes. Let us, we start our journey by the prevention of diabetes. Thank you, my organizer, for organizing this seminar. Thank you, participants. Thank you, all of the guest speakers, and thank you, all my